at is the Integrated Molecular Imaging Center, which is critical in the diagnosis and treatment of cancer. And I'm joined here by Daniel Oguna. He is a nuclear medicine technologist who will be walking us through what exactly happens before a patient is diagnosed with cancer. Thank you for joining us.
Okay, welcome.
And this is the Control and Interpretation Center. Daniel,
Sure.
What exactly happens here?
Now, cancer patients are prepared for an examination. There are some preparations which we do before an imaging is done on the patient. And right here, the patients who come here are the ones who have been prepared and are ready for imaging. And it is done right inside.
Okay.
So we'll go in and see really what happens
Let's take a look.
on the imaging process. So the whole setup here is what we call the imaging console. We enter the details of the patient from this side, but then the patient gets in through the other door, and we position from inside.
So very important, what equipment in terms of technology and indeed equipment is needed in terms of cancer diagnosis, and what machine is this?
This one is called a PET-CT, or if you like it, a positron emission tomography scanner. It's a 2-in-1 scanner. It has right in here a CT that is available in most of the equipment that we have. Then what makes it unique is that part there that has the PET systems. Right in here, when we have a cancer patient, we put them on this table. I know we will move the table up just to show you.
So the patient is put here and it is wheeled up?
Yes, and we move the table up. When the patient lies in here, the system is automated. We will just leave the patient here, and the rest of the things will be controlled on the other side. But we put in the patient on the table. We give them all the necessary instructions that they need to know and what they should expect during the examination.
But what exactly are you examining here? Because it looks like there's a head space there. So what exactly and what type of cancer would you be looking to diagnose here?
Now, PET-CT is unique because it's able to do both anatomical or structural imaging and functional or physiology. You're able to see really how your body organs are and how they work, something that is only unique to the PET scanner. With the rest of the imaging that we have, you're not able to see mostly the physiology. What you're able to see with the imaging like MRI, on the standalone CT, ultrasound, X-ray, is just the structure.
Now, the process of diagnosing cancer and the key steps involved, take us through that.
When a cancer patient comes to our hospital, a patient who is booked and is ready for the imaging, what we do to the patient is administration of a small dose of a radiopharmaceutical. It's a small radioactive injection that a patient is given. Once that is done, we give the patient about 1 hour for the medication that was injected to go all around the body before we bring in the patient here for the scan. Now, how this works is that, cancer cells are hypermetabolic. That means they are feeding more than your normal cells. And so when we give the radioactive injection that contains glucose, these cancer cells are going to uptake more glucose than the rest of your normal cells.
And how important, Daniel, is early diagnosis and prognosis in terms of better treatment outcomes if indeed it is found that the patient has cancer?
Now, the advantage we have with the PET-CT is that it is able to pick very small cancers in very early stages. And when cancers are picked early, there are better chances that the patient will survive. The outcomes will be better when cancers are picked better. And this is the best modality for early detection of the cancers. So with this scan here, we're able to pick the cancers as early as they appear.
And also now advancements in terms of diagnostic technologies and what we currently have in the country.
Now, right now, within the sub-Saharan Africa, this is the only center that has a PET-CT scanner. It's only available within this region, and we basically do all the patients within as a sub-Saharan Africa, including West Africa. All those patients come over to our hospital for this examination.
Now, after a diagnosis is made in terms of biopsies and, of course, the specimen interpretation, what are the technical terms? And in terms of biopsies, how long does that take? Is that currently done locally here in the country?
Yes, right now here we do not take biopsies from this point. Now, what we do here is the imaging. We guide the doctors, like the ones taking the biopsies, on the exact point where they're going to take the biopsies. But even with the samples that are taken from the patient, right now there are many labs, including this hospital, has one of the most advanced laboratories. So the patient really does not need to go to what used to happen earlier on, where patients would wait for 2 or 3 weeks for their biopsy results to come out. Yeah. Once the imaging is done here and the biopsy is recommended, that biopsy will be done here. The lab work will be done here, and the results will be out in few days, if not hours.
Okay, yeah. Well, thank you very much, Daniel Oguna. We are here at the Integrated Molecular Imaging Center at the Kenyatta University Teaching, Referral and Research Hospital. We've walked through diagnosis, and early diagnosis is said to be key in terms of getting better treatment outcomes. We're back with more in just a bit. Many thanks. Back to you, studio.
Thank you very much, Lilian Muli, right there. Just showing